In a new study published in JAMA Network Open, a team of scientists have discovered that individuals diagnosed with hypochondriasis, commonly known as health anxiety disorder, face a significantly higher risk of death compared to those without the condition. This study, the first of its kind, indicates an increased likelihood of both natural and unnatural causes of death, particularly suicide, among so-called hypochondriacs. The study was motivated by the challenges and complexities surrounding hypochondriasis. Characterized by an excessive preoccupation with having one or more serious illnesses, this condition often leads to a catastrophic interpretation of bodily symptoms, resulting in excessive health-related anxiety. Despite its prevalence, hypochondriasis is frequently underdiagnosed. Many health professionals either overlook or misunderstand the condition, and the stigma attached to the diagnosis further complicates recognition and treatment. The researchers embarked on this study to shed light on the real-world implications of hypochondriasis, particularly its impact on mortality rates, a largely unexplored aspect until now. There was a clear gap in the literature, explained study author David Matej-Coles, a professor at the Center for Psychiatric Research at Karolinska Institutet. While the risk of death amongst psychiatric patients in general is well known, there were no previous studies in hypochondriasis. Some old studies had even suggested that the risk of suicide may be lower in individuals with hypochondriasis, compared to unaffected individuals, as they have no desire to die. Our hunch, based on clinical experience, was that this would be incorrect. Probably the main limitation is that the disorder is markedly underdiagnosed by clinicians, which means that despite having the entire population of Swedish cases, we are still missing quite a few, Matej-Coles said. It is likely that our cohort includes the most severe cases, and the results should be interpreted in this light. Given these limitations, future research should focus on including data from primary care and exploring other potential factors influencing mortality in individuals with hypochondriasis. Studies could also benefit from a broader international scope to see if these findings hold true in different healthcare systems and cultural contexts. Taken together, these findings illustrate a paradox, whereby individuals with hypochondriasis have an increased risk of death despite the pervasive fears of illness and death. In this study, most deaths could be classified as potentially preventable. Dismissing these individuals' somatic symptoms as imaginary may have dire consequences, the researchers concluded in their study. More should be done to reduce stigma and improve detection, diagnosis, and appropriate integrated, i.e., psychiatric and somatic, care for these individuals. Evidence-based psychological treatments for hypochondriasis exist and, in some countries, are even available as low-threshold, guided self-help via the internet, substantially increasing access to treatment. The hope is that increased detection and access to evidence-based treatment will reduce somatic morbidity, suicidality, and mortality in this group. The study, All-Cause and Cause-Specific Mortality Among Individuals with Hypochondriasis, was authored by David Matej-Coles, Kyoko Isomura, Anna Sidorchuk, Daniel Rautio, Volin Z. Ivanov, Christian Ruck, Susanna Osterman, Paul Lichtenstein, Henrik Larsson, Ralph Kuja-Halkola, Zheng Chang, Isabel Brickel, Eric Hedman Lagerlof, and Lorena Fernandez de la Cruz.